turmeric, Curcuma longa, rhizome, and curcumin. An herbal product that treats blood clot prevention, viral infection, cognitive function, osteoarthritis, scabies, dyspepsia, irritable bowel syndrome, cancer, inflammation, HIV, AIDS, rheumatoid arthritis, oral leukoplakia, uveitis, peptic ulcer disease, high cholesterol, liver protection, and gallstone prevention, bile flow stimulant. History. The rhizome, root, of turmeric, Curcuma longa Lin, has long been used in traditional Asian medicine to treat gastrointestinal upset, arthritic pain, and low energy. Laboratory and animal research has demonstrated the anti-inflammatory, antioxidant, and anti-cancer properties of turmeric and its constituent curcumin. Preliminary human evidence suggests possible efficacy in the management of dyspepsia, heartburn, hyperlipidemia, high cholesterol, and scabies when used on the skin. More studies are needed to verify these whole benefits, so better human studies are needed before a general recommendation can be made. Evidence. Disclaimer. These uses have been tested in humans or animals. Safety and effectiveness have not always been proven. Some of these conditions should be evaluated by a qualified healthcare provider. Blood clot prevention. Early research suggests that turmeric may prevent the formation of blood clots. Cancer. Several early animal and laboratory studies report anti-cancer, colon, skin, breast, properties of curcumin. Many mechanisms have been considered, including antioxidant activity, anti-angiogenesis, prevention of new blood vessel growth, and direct effects on cancer cells. Cognitive function. Curcumin has been shown to have antioxidant and anti-inflammatory properties and to reduce beta amyloid and plaque burden in lab studies. Dyspepsia, heartburn. Turmeric has been traditionally used to treat stomach problems, such as indigestion from a fatty meal. There is preliminary evidence that turmeric may offer some relief from these stomach problems. However, at high doses or with prolonged use, turmeric may actually irritate or upset the stomach. Gallstone prevention, bile flow stimulant. It has been said that there are fewer people with gallstones in India, which is sometimes credited to turmeric in the diet. Early studies report that curcumin, a chemical in turmeric, may decrease the occurrence of gallstones. However, reliable human studies are lacking in this area. The use of turmeric may be inadvisable in patients with active gallstones. High cholesterol. Early studies suggest that turmeric may lower levels of low-density lipoprotein, bad cholesterol, and total cholesterol in the blood. HIV/AIDS. Several laboratory studies suggest that curcumin, a component of turmeric, may have activity against HIV. Inflammation. Laboratory and animal studies show the anti-inflammatory activity of turmeric and its constituent curcumin. Irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a common functional disorder for which there are limited reliable medical treatments. One study investigated the effects of Curcuma xanthorrhiza on IBS and found that treatment did not show any therapeutic benefit over placebo. Liver protection. In traditional Indian Ayurvedic medicine, turmeric has been used to tone the liver. Early research suggests that turmeric may have a protective effect on the liver. Oral leukoplakia. Results from lab and animal studies suggest turmeric may have anti-cancer effects. Osteoarthritis. Turmeric has been used historically to treat rheumatic conditions. Laboratory and animal studies show the anti-inflammatory activity of turmeric and its constituent curcumin, which may be beneficial in people with osteoarthritis. Peptic ulcer disease, stomach ulcer. Turmeric has been used historically to treat stomach and duodenal ulcers. However, at high doses or with prolonged use, Turmeric may actually further irritate or upset the stomach. Rheumatoid arthritis. Turmeric has been used historically to treat rheumatic conditions and based on animal research may reduce inflammation. Scabies. Historically, turmeric has been used on the skin to treat chronic skin ulcers and scabies. It has also been used in combination with the leaves of the herb Azadirachta indica ADR or neem. Uveitis, eye inflammation. Laboratory and animal studies show the anti-inflammatory activity of turmeric and its constituent curcumin. A human study suggests the possible benefit of curcumin in the treatment of uveitis. Viral infection. Evidence suggests that turmeric may help treat viral infections. Tradition. Warning. Disclaimer. The below uses are based on tradition, scientific theories, or limited research. They often have not been thoroughly tested in humans. And safety and effectiveness have not always been proven. Some of these conditions should be evaluated by a qualified healthcare provider. There may be other proposed uses that are not listed below. Abdominal bloating, Alzheimer's disease, antibacterial, antifungal, antimicrobial, antispasmodic, antivenom, appetite stimulant, asthma, boils, breast milk stimulant, bruises, cataracts. Chemoprotective, contraception, cough, cystic fibrosis, diabetes, diarrhea, dizziness, epilepsy, flavoring agent, gas, gonorrhea, heart damage from doxorubicin, adriamycin, Doxil. Helicobacter pylori infection, hepatitis, high blood pressure, histological dye, human papillomavirus, HPV, hypoglycemic agent, blood sugar lowering. Infections, methicillin-resistant Staphylococcus aureus, insect bites, insect repellent, jaundice, kidney disease, kidney stones, leprosy, liver damage from toxins, drugs, male fertility. Menstrual pain, menstrual period problems, lack of menstrual period, multi-drug resistance, neurodegenerative disorders, pain, parasites, ringworm, scarring, scleroderma, weight reduction. Dosing. Adults, over 18 years old. Doses used range from 450 mg of curcumin capsules to 3 grams of turmeric root daily, divided into several doses, taken by mouth. As a tea, 1 to 1.5 grams of dried root may be steeped in 150 milliliters of water for 15 minutes and taken twice daily. The average dietary intake of turmeric in the Indian population may range between 2 to 2.5 grams, corresponding to 60 to 200 milligrams of curcumin daily. A dose of 0.6 milliliters of turmeric oil has been taken 3 times daily for 1 month, and a dose of 1 milliliter in 3 divided doses has been taken for 2 months. One reported method for treating scabies is to cover affected areas once daily with a paste consisting of a 4-to-1 mixture of Azadirachta indica ADR, neem, to turmeric, for up to 15 days. Scabies should be treated under the supervision of a qualified healthcare professional. Children, under 18 years old. There is no proven or safe medicinal dose of turmeric in children. Safety. Disclaimer. Many complementary techniques are practiced by healthcare professionals with formal training, in accordance with the standards of national organizations. However, this is not universally the case, and adverse effects are possible. Due to limited research, in some cases only limited safety information is available. Allergies. Allergic reactions to turmeric may occur, including contact dermatitis, an itchy rash, after skin or scalp exposure. People with allergies to plants in the Curcuma genus are more likely to have an allergic reaction to turmeric. Use cautiously in patients allergic to turmeric or any of its constituents. including curcumin, to yellow food colorings, or to plants in the Zingiberaceae, ginger, family. Side effects and warnings. Turmeric may cause an upset stomach, especially in high doses or if given over a long period of time. Heartburn has been reported in patients being treated for stomach ulcers. Since turmeric is sometimes used for the treatment of heartburn or ulcers, caution may be necessary for some patients. Nausea and diarrhea have also been reported. Based on laboratory and animal studies, turmeric may increase the risk of bleeding. Caution is advised in patients with bleeding disorders or taking drugs that may increase the risk of bleeding. Dosing adjustments may be necessary. Turmeric should be stopped prior to scheduled surgery. Limited animal studies show that a component of turmeric, curcumin, may increase liver function tests. However, one human study reports that turmeric has no effect on these tests. Turmeric or curcumin may cause gallbladder squeezing, contraction, and may not be advised in patients with gallstones. In animal studies, hair loss, alopecia, and lowering of blood pressure have been reported. In theory, turmeric may weaken the immune system and should be used cautiously in patients with immune system deficiencies. Turmeric should be used with caution in people with diabetes or hypoglycemia or people taking drugs or supplements that lower blood sugar. Pregnancy and breastfeeding. Historically, turmeric has been considered safe when used as a spice in foods during pregnancy and breastfeeding. However, turmeric has been found to cause uterine stimulation and to stimulate menstrual flow, and caution is therefore warranted during pregnancy. Animal studies have not found turmeric taken by mouth to cause abnormal fetal development. Interactions with drugs. Based on laboratory and animal studies, turmeric may inhibit platelets in the blood and increase the risk of bleeding caused by other drugs. Some examples include aspirin, anticoagulants, blood thinners, such as warfarin, Coumadin, or heparin, antiplatelet drugs such as clopidogrel, Plavix, and non-steroidal anti-inflammatory drugs such as ibuprofen, Motrin, Advil, or naproxen, naproxen, Aleve. Based on animal data, turmeric may lower blood sugar and therefore may have additive effects with diabetes medications. In animals, turmeric protects against stomach ulcers caused by non-steroidal anti-inflammatory drugs, NSAIDs, such as indomethacin, indocin, and against heart damage caused by the chemotherapy drug doxorubicin. Adriamycin. Turmeric may lower blood pressure levels and may have an additive effect if taken with drugs that also lower blood pressure. Turmeric may lower blood levels of low-density lipoprotein, LDL or bad cholesterol, and increase high-density lipoprotein, HDL or good cholesterol. Thus, turmeric may increase the effects of cholesterol-lowering drugs such as lovastatin, Mevacor, or atorvastatin, Lipitor. Based on animal studies, turmeric may interfere with the way the body processes certain drugs using the liver's cytochrome P450 enzyme system. As a result, the levels of these drugs may be increased in the blood and may cause increased effects or potentially serious adverse reactions. Patients using any medications should check the package insert and speak with a healthcare professional or pharmacist about possible interactions. When taken with indomethacin or reserpine, turmeric may help reduce the number of stomachs and intestinal ulcers normally caused by these drugs. However, when taken in larger doses or when used for long periods of time, turmeric itself can cause ulcers. Interactions with herbs and dietary supplements based on animal studies. Turmeric may increase the risk of bleeding when taken with herbs and supplements that are believed to increase the risk of bleeding. Multiple cases of bleeding have been reported with the use of ginkgo biloba, some cases with garlic, and fewer cases with saw palmetto. Based on animal data, Turmeric may lower blood sugar. Individuals taking other herbs or supplements or diabetes medications should speak with a healthcare professional before starting turmeric. Turmeric may lower blood levels of low-density lipoprotein, LDL or bad cholesterol, and increase high-density lipoprotein, HDL or good cholesterol. Thus, turmeric may increase the effects of cholesterol-lowering herbs or supplements such as fish oil, garlic, guggul, or niacin. Based on animal studies, turmeric may interfere with the way the body processes certain herbs or supplements using the liver's cytochrome P450 enzyme system. As a result, the levels of other herbs or supplements may become too high in the blood. It may also alter the effects that other herbs or supplements possibly have on the P450 system. Turmeric may lower blood pressure and may therefore have an additive effect if taken with herbs that also lower blood pressure.